President Cyril Ramaphosa says the highly contested National Health Insurance Bill is on his desk and he is still applying his mind. He made the remarks last night during his State of the Nation address. Now, the bill, as we know, was passed by both houses of Parliament last year. This week, Business Unity South Africa called on the President to send it back to Parliament for re-evaluation and for amendments. The fraternity saying it was considering taking legal action against the President and his government if indeed the NHI Bill is pushed ahead. Let's get you some analysis on what the President had to say and the NHI Bill as a whole as well. We're joined this morning by the Chair of the South African Medical Association, Dr. Mvuyisi Mzukwa. It's always good to talk to you, sir. Thanks very much indeed for coming on. It's not very heartening to hear that the President is still applying his mind at this stage. Would you agree?
Good morning to you, Michelle, and your team and your listeners as well. Thanks for having me. We know that, the President is under pressure. The political party that is leading is really waiting for him, pushing him to sign the bill. But I think it would, be good if the President could take time, look at the bill properly, because there are concerns that have been raised not only by associations but also business entities that are questioning the state that there are issues that need to be attended to. Like you said in your introduction, that the fears of healthcare workers had not been attended to, concerns, deep concerns around the bill have not been attended to. So to be rushing into signing that bill into law, I think it is a huge problem, because issues that you have raised, Michelle, are genuine issues. We are saying this bill, in fact, the healthcare system is actually not prepared for this bill. You've heard recently that we've got unemployed doctors. If you can employ about 1,000 doctors at the current moment, how are you going to be able to, attend to the whole country without the proper healthcare personnel on the ground? So those are the issues that you are raising to say, I think this is a very crucial policy. A reform is needed in South Africa, but you can't use it as a political football.
Right, absolutely. There's definitely no argument there, Dr. Mzukwa. The fact that reform in healthcare is desperately needed and equitable access to healthcare and life-saving treatment is a necessity, right? NHI, in its, as a concept, is not a new one. It's not something that will be unique to South Africa. But we have seen problems with its implementation elsewhere. In the UK, for example, in the US as well, their versions of NHI have not always had good stories to tell.
Yes, Michelle. I mean, if you look, for example, in the UK, the backlog that is out is there. Of the last time I checked was about 7.8 million of people waiting to be done procedures in the state. And if you look, for example, the payments or the retaining of healthcare workers, some are leaving the UK to other parts of the world, and these are first world countries. We're talking about a country, people who can't even attend to their own economy. In fact, a country that has rampant corruption. You are failing to deal with corruption, yet you want to put a pool, some money in a pool, so that people can access it and do what they normally do. So I don't think that, we are prepared as a nation, to be implementing the NHI if these issues that have been raised by professionals, by business entities, have not been attended to. And the President knows very well that if he signs this, it will be challenged in the court of law.
Yes, absolutely. And you bring up such an important issue, the issue of corruption that's dogged the health department here in Gauteng, certainly, and in many other provinces around the country. Because the point, Dr. Mzukwa, is that we do have enough money in our healthcare budget, right? If the money were to go where it's meant to be going, and that's to the citizens of the country. And we know that that is not the case, and that really is primarily the reason why we're suffering, and the people of South Africa are suffering to access equitable healthcare.
One of the issues, Michelle, that have been raised by the health ombuds, Professor Makgoba, on top of what you are saying, is the issue of leadership and governance. Mm-hmm. We know that we have a serious issue of leadership and governance. And this is a crucial issue. You can't just be concerned about, funding and financing the healthcare system if you not worked on the leadership and governance and all these other matters. So the seriousness of that pillar is so important in the implementation of the NHI. And the problem is not only in the provinces, but the problem is also nationally. We know that we have lost some of these colleagues to the World Health Organization. Critical technocrats, that can be able to implement NHI. And we are left with yes men type of technocrats who are going to be pushed to implement the NHI without proper consideration of what is needed on the ground. I mean, this government, I always say, they make lots of promises, In healthcare, they're doing the same thing. I mean, we've got what we call, Michelle, social determinants of health. For example, I make an example of the Eastern Cape, where about more than 80% of villages don't have access to water. So you can't just throw in a health bill and think that you are going to sort out everything. You need to make sure that there is enough clean running water in those areas. And many other issues like employment and stuff like that. Yeah. So you can't be using the bill, just the bill, in healthcare and think that you are going to reform the country.
Yeah. Absolutely. It'll be like putting a Band-Aid on a gushing wound, right? It's just not going to do the trick. And all of our socioeconomic challenges are so intricately linked, especially as you talk about access to water. Our hospitals not too long ago also experiencing water cuts, power cuts as well. Look, whatever happens, Dr. Mzukwa, the NHI will take years essentially to be implemented, right? We've been promised by the health minister time and time again that those governance structures that you talk about will be in place and that there will be proper oversight. But however we look at it, there is going to be pushback from the private sector because this is going to be a hand-in-hand situation. The private sector will have to work with government, right, in establishing NHI. Do you foresee that we're going to be in court for a long time?
I foresee that we'll be in court for a long time, Michelle, because one, we know that, our colleagues or the government they always keep making promises, but those promises are not implemented. For example, let's look at the NHI itself. There were pilot projects. Instead of us piloting NHI in South Africa, we're told, no, those pilot projects actually, they were looking at strengthening health systems in the country. So it was not pilot projects. So because they wanted to run away from the fact that those projects failed. So they didn't want to call it failed. They said, no, they were not run. So how do you put a policy without evidence? Yeah. You're just copying and pasting. So that's one thing. But the other thing, Michelle, remember that we've got the National Health Act. It talks about the primary health care and how it should be working. That has not been implemented by the Department of. It's on paper, it's law, but our primary health care is in tatters. Yeah,
and any South African that has had to access health care on that front will tell the exact same story.
Exactly, Michelle, because, I mean, if you, for example, you took an opportunity, I mean, this president had an opportunity to employ those doctors that are not employed at the moment and populate those clinics, primary healthcare clinics and the district hospital. That would be enough for us, to access, universal health coverage. But no, they cannot. They want to have access to this pool of money.
Sure. Strong words there. Dr. Mvuyisi Mzukwa, let me thank you for your time this morning, and this NHI discussion is no doubt far from over. Dr. Mzukwa is the chairperson of the SA Medical Association.